to the Toronto Sweat Clinic and the Pink and Blue Mag live show. I am Nicole, and we are here with Nurse Barinder and patient Shannon, and we are just sitting in on a treatment for excessive sweating. I know that a lot of people have this problem. I always joke that I'm going through early menopause, and I know a lot of you lovely mamas out there have this problem also, which a lot of us don't like to admit or talk about, but a lot of people that come in have excessive sweating, right? And I know it can sometimes be like annoying and embarrassing and something that you don't want to worry about. So there are treatments available, and can you tell us about some of the treatment options?
Yep, so we have 3 different types of treatments, one being Miradry, second botox, and third is a surgical procedure, which is ETS. Today we'll be talking mainly about Miradry, which is a permanent solution to underarm sweating, mainly focusing on underarm sweating. So this is a procedure which is non-invasive, so no surgery is required. It's done in office. You come for an hour and you're going home. That's it.
That's it, all right. And so when it comes to underarm perspiration, why do some have more than others?
Okay, so there's 2 types of sweat glands, one that produce odor and one that is for thermal regulation. When it comes to being diagnosed with hyperhidrosis, it's because there are hyperactive thermal regulation glands. So these patients come in and they have hyperactive thermal regulation glands, which then are making the odor glands hyperactive as well, and that's what causes this whole reaction, and that's why patients come in.
Well, it's great that you guys are here. Can you explain, I know you touched upon what Miradry is, but what exactly is it? Like, what's the process when somebody comes in and gets it done?
Okay, so the first step that happens is we speak to the patient, get an understanding of what they are looking for. Are they looking for more permanent, or are they looking to come in regularly and do Botox? More people opt out for a permanent solution because these are patients who have, it's embarrassing, they have sweat marks, they're not able to wear colored shirts, they're professionals, they're students.
Right.
So these patients come in, we'll complete a consultation, and then we proceed with the procedure. The patient will lie down just like this, and it's an electromagnetic therapy, which it's customized to you. We do a measurement of your underarm, so it's very customized, and we have a template which we measure your underarm with, just like that.
Okay.
And
it's so interesting.
Yeah, so it's customized to you.
Right.
Yeah.
And if anyone has any questions, please write in, share with your friends that might be interested in this, because you never know who's suffering and isn't talking about it. But this is why we're bringing it to everyone's attention today. And how does it exactly alleviate the symptoms? Like, why does this last more than doing the other treatments like Botox?
So electromagnetic therapy, once those sweat glands, hyperactive sweat glands are eliminated, they do not grow back.
Okay.
So that's the benefit of this treatment. Doing Botox, it is a great treatment. However, every 6 or 7 months, you will be coming back. This treatment, it's permanent. You get it done, and you see a major reduction.
And so what is the machine there? Like, if you could just demonstrate for us.
So this is what I work with on you.
Okay.
So basically, you're going to be laying there comfortable. We do have a anesthetic that I
numb the area
with, so you don't feel the treatment.
That's only like having an epidural.
Yeah, it's like having an epidural. You won't feel a thing.
Okay.
So you are completely numb in the underarm safely. It will last probably within less than 12 hours. It'll fade away that day.
Okay.
So I'm basically going for about 20 seconds in each area.
So it's like having a laser treatment almost.
It's like having a laser.
Does it help with any other conditions or with hair removal or anything like that?
It actually does help with hair removal.
Okay. See? That's a plus, people.
It's been approved for hair removal by the FDA as well.
Okay.
And 2 treatments compared to
laser. Do people come in for that and use this for that? Or
they can now.
They can, okay.
So we do offer it for just hair removal as well.
Okay.
So
do you get rid of unibrows at all?
Well, currently it's just for underarms.
Okay.
But it's great because laser treatments, you need 12 treatments. This one, you can get 2 treatments.
Oh, that's amazing. My sisters did the 12 treatments. Sorry to call you out.
So it'll get rid of odor as well.
Okay.
Hair glands. and sweat glands. Sweat glands, odor glands, and hair glands are being affected by this treatment.
That's awesome. That's great. Thank you. It's so informative. And are there any side effects?
The side effects that you'll notice, there's not much downtime to this procedure. So you will have some redness, some swelling, which will deteriorate over about 1 to 2 weeks. You may experience slight numbness, which will go away in a week or 2 as well. And a little bit of lumps, but nothing that'll turn anyone away. So there's very little downtime. We usually recommend coming in and preparing yourself to be off for about 12 hours, no exercising for a few days, 3 to 4 days. So usually patients will come in on a Thursday, Wednesday, and then take, a
few days just to recover.
To rest and recover.
Okay. And so I know that you touched upon that it's basically one treatment. So how long does it normally take, the whole procedure itself?
So the whole procedure, the first treatment will usually take about 90 minutes just because of the consultation. I go over all the information with the patient, what to expect during the procedure and what happens after the procedure. And for some patients that do require the second treatment, usually takes about an hour.
Okay. So you're in and out. It's like getting a dental plan.
Yeah.
Right, that's not bad. And after a full course of treatments, do you have to go in for any, now see, I answered all the questions for you. Do you have to go in for any treatments to follow up for it to stay effective, or is it just like the 1 to 2 treatments and you're done?
So for most patients, some patients, 1 treatment is enough. However, some more severe cases do require the 2 treatments. And you'll see about 85% reduction in these hyperhidrosis patients. So that to them is usually enough because you will still have some sweating, just because it's not possible to eliminate all of them. However, for the patients who have been experiencing this, it's comfortable. They are good with 2 treatments.
So I know that the Miradry is mainly for the underarms, but if you have excessive sweating in your hands, what treatment do you normally do for that?
So for hands, we have the botox treatment available, and if you are going for the surgical procedure, which is the ETS done by a surgeon, then we can treat that as well. So botox and the surgery are the treatments.
Does this, when you do this, does it sometimes affect the other sweat glands or only isolated to the underarms?
So the underarms, believe it or not, are only 2% of our sweat glands. So you will not see a major difference anywhere at any other part of the body.
And how much does it usually cost for a treatment like this?
1 treatment is $1,600. However, keeping in mind, the coping mechanisms that people go through for the rest of their life, it's totally worth it.
Well, you whiten your teeth and you used to spend like over $500. So, is Miradry a solution for everyone, or is there some limitations on who could actually get the treatment? I know they probably cover that in the consultation.
Right. So it's available for anyone who is going through this awful diagnosis of hyperhidrosis. So moms, and sometimes guys think, hey, I'm a guy, I'm supposed to be sweating. No, we have guys, we have girls, women, men.
What if you're not like excessive sweating, but it's bothering you that you're sweating a lot? So it doesn't have to be like profuse sweating. It could just be like you're at the gym, you're sweating a lot, it's bothering you, you don't want to deal with it anymore.
If you're a professional.
If you're living in Florida, for all of my viewers in Florida, I'm from Florida, and you're sweating all the time. And so we touch upon, is it a solution for everyone, or is it mainly if you're really suffering a lot?
So it's for anyone. Professionals that are sweating, they're doing presentations, raising their arms all the time, and they don't want that little circle at all of sweat, they can come in and get it done. You don't have to be profusely sweating, like you said. So anyone can come in.
Maybe I'll send in my husband.
How
do you know if you are a desirable candidate and anyone that shouldn't be using this as a solution?
Well, we do go over in the consultation if there's any serious medical concerns. Our doctor, he will determine if you are eligible or not eligible. However, in most cases, everything is okay. But give us a call. We can quickly review that for you and determine if you are okay with it.
Awesome. Thank you so much.
No
Do you have any
problem.
questions, Shannon? No? Is there any questions from our audience?
No, everything seems good right now.
Yeah.
Lots of people tuning in to watch.
Oh, that's awesome. Thank you so much for tuning in. Again, please share and comment. We know that this is a problem, like, you know, that Shannon said. Not Shannon, I'm sorry. Verinder said that a lot of people suffer from this in silence, and that it's not something that people like to talk about, and it shouldn't really be that embarrassing. Everybody sweats. And one question that I have that I wanted to bring up, so that other people might have, is that people, you know, use their sweat glands as a form of getting rid of toxins, and it's a natural part of your body.
Right.
What were you saying, Rebecca, that it's part of your...
Well, she touched upon it a bit, but, like, sweating is used as a thermoregulatory mechanism for the body. So, like, your body has a set temperature, and, like, your body wants to maintain
For homeostasis.
which is a set temperature, a set pH, which is, like, acidity, and a few other things. But basically, I was wondering if you're cutting off, like, one of your body's thermoregulatory mechanisms, if it makes up for it in other ways. But I was talking about it with my mom as well,
Which is a
and
doctor.
she was saying that for a lot of people it's actually pathology, so that might be one answer, that your body isn't actually sweating to maintain homeostasis at that point, it's sweating excessively, to the point where it's more of, like, not a disease, but like something that's not working for you but working more against you. But
Right.
I don't
And
know
that's
if
why
I have more
people come in,
comments on
right?
it.
Because
Right.
this is only what, 2%? What was the
2% of your
2%.
sweat glands are actually in your underarms.
Right, so it doesn't really affect that whole
Right.
process of your
Right.
body, right?
So I think that's the main point.
I just
It's only
wanted to point that out to our
2%.
viewers, because
Right.
that's something that maybe not in those words,
Right.
the medical terminology, thank you, Rebecca, but it is something that, like, probably often people, because we found this
us.
really interesting, that's why I wanted to come in today, because it really is something that people, and I actually have a friend that went through, before they came out with this solution, went through the whole process and had to have the surgery done in her hands and underarms. So
Right.
I know that it is something that people really truly suffer from. Thank you again.
No
It was
problem.
fabulous coming
No
in today.
problem.
Thank you for taking the time and letting us sit in on your treatment. And I hope you have a wonderful weekend. We're almost there for Friday. And thank you for tuning in.
Thank you.